What if your baby could talk without using words? Babies have a secret language, and it's written in their body. From tiny movements to sudden changes in posture, these signals are often their only way of saying something is wrong. In this video, you'll discover 10 silent signs doctors warn parents never to ignore. Some may seem small, but paying attention could make a life-changing difference. Stay with me, because understanding these signals might just help you protect your baby when they need you most. Babies can't tell us where it hurts, and they can't explain what feels wrong. Instead, they rely on movements, expressions, and posture to communicate. Pediatricians say these nonverbal cues can reveal hidden problems long before words ever could. Spotting them early doesn't just prevent bigger issues, it also builds a deeper bond of trust. When you learn to read your baby's signals, you're not just keeping them safe. You're showing them that their voice, even without words, truly matters. The first step in understanding baby body language is observation. Create a calm, quiet space where you can really notice your baby's movements and reactions. Don't focus on just one signal in isolation. Doctors say it's often the combination or repetition of signs that matters most. Every baby is unique, so get to know your child's baseline, what's normal for their feeding, sleeping, and daily activity. If something suddenly feels different or a pattern keeps showing up, that's when it's time to check in with your pediatrician. Remember, your instincts matter. If something feels off, don't ignore the 10 body language signs you should never ignore. 1. Arching the back or stiffening. If your baby often arches their back or becomes stiff, it could mean discomfort, acid reflux, or even pain. Occasional arching is normal, but if it happens regularly, especially during feeding, it's worth talking to your doctor. 2. Persistent trembling or shaking limbs. A little shiver can be harmless, but repeated trembling or jittery arms and legs may point to low blood sugar, neurological issues, or even seizures. If you notice this often, seek medical evaluation right away. 3. Strong face turning or gaze avoidance. Babies sometimes look away when they're overstimulated, but if your baby consistently avoids eye contact or sharply turns their face, it could signal stress or sensory overload. Reduce noise and activity, but if it doesn't improve, consult your pediatrician. 4. Clenched fists beyond normal age. Newborns naturally clench their fists, but if this continues well after 3 to 4 months, it might suggest a neuromuscular issue. Keep track and bring it up during checkups. 5. Pulling knees to the chest or curling legs. Drawing the legs up tightly can mean gas, colic, or stomach pain. Gentle burping or tummy massage may help, but if the pain looks severe or keeps returning, get medical advice. 6. Sudden changes in skin color, pale skin, blue lips, or a bluish tint on the face and fingers should never be ignored. These signs may point to poor circulation or oxygen problems. This is an emergency. Seek help immediately. 7. Abnormal or irregular breathing, gasping, noisy breathing, or long pauses between breaths may show airway or lung trouble. Babies can have short pauses, but anything prolonged or difficult needs urgent care. 8. Excessive drooling or trouble feeding. Drooling is normal when teething, but constant drooling combined with choking, coughing, or refusing to feed could signal an infection, swallowing difficulty, or a neurological concern. A doctor should evaluate this. 9. High-pitched, unusual crying. Every baby cries, but a sudden, sharp, high-pitched cry that doesn't sound like their usual voice is a red flag. It may indicate pain, an ear infection, or even a neurological problem. Always investigate unusual cries. 10. Limp posture or lack of movement. If your baby seems floppy, weak, or unusually still, it's a serious warning sign. This could mean dehydration, illness, or shock. In these cases, seek medical help right away. Each of these body language signals may look small on their own, but they can be powerful warnings. Knowing them can help you act quickly and keep your baby safe. Not every unusual move means something is wrong. Babies sometimes arch their backs, clench fists, or grimace for harmless reasons, often just because they're adjusting to the world around them. What doctors warn against is ignoring patterns. The danger is when these actions become frequent, intense, or very different from your baby's usual behavior. Think of your baby's baseline as their personal normal. A sudden change from that is more telling than a single episode. So instead of panicking over every sign, trust your instincts. If your gut says something feels off, it's always better to check. Some signs are mild, others are urgent. If you ever see breathing problems combined with blue lips or a floppy body, don't wait. This is a red flag and needs emergency care. Another warning is when symptoms appear suddenly and worsen quickly, like an unusual cry that turns into limpness or feeding refusal. Even if the issue isn't an emergency, persistent, or worsening changes should be shared with your pediatrician. And remember, regular checkups are not just routine. They're a chance to discuss small concerns before they grow into bigger problems. Your baby's safety always comes first. Your baby's comfort starts with the environment you create. Keep it calm, gentle, and safe from overstimulation. Simple actions, swaddling, tummy support, or holding in a soothing position, can ease many mild discomforts before they escalate. Pay attention early because responding at the first small cue prevents bigger stress later. If you notice anything unusual, write it down. A log of behaviors, times, and triggers can give doctors valuable clues. This doesn't just help your pediatrician, it also helps you feel more confident and connected with your baby's needs. Small steps can make a big difference. Let's quickly go back over the 10 signs: back arching, trembling limbs, gaze avoidance, clenched fists, curled legs, skin color changes, breathing trouble, feeding difficulties, high-pitched cries, and limp posture. Each of these signals might look simple, but they can carry powerful messages about your baby's health. Watching body language is not just about spotting illness. It's about listening to the only voice your baby has right now. The more you observe, the more you'll understand. Over time, you'll notice small details others might miss. Your baby's body language is their way of trusting you to listen. Parenting can feel overwhelming, but knowledge like this gives you an edge. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more tips that could protect your little one. Share your experience in the comments. Has your baby ever shown one of these signs? Your story might help another parent. And finally, remember, this video is for education only. It's not a replacement for medical advice. If you're ever unsure, your doctor is the best guide. Stay alert, stay calm, and keep listening to the silent language of your baby.